In today's quick video, let's talk about collagen. Let's dive in. So collagen is probably the most abundant protein in our body. It is present not only in our skin, but also in our tissues as far as our ligaments and tendon as well. Collagen production does tend to decline as we age, so there's a lot of interest in using collagen around anti-aging, especially for our skin, but as more so as well as using it for joint pain and inflammation as well. Now, as far as using collagen for joint pain, inflammation, or kind of repair of tendons and muscles, there are not a lot of studies done in older adults. There are a few studies done in younger athletes that are looking to return to sport faster. And those studies have shown that collagen supplementation can help get those athletes back into playing or back into form a little bit quicker than the placebo group or the group without using the collagen. Now, we're kind of extracting from that and saying that, oh, well, if young adults can use it, then it's probably applicable to older adults as well. And so we're seeing it used more and more for joint pain, joint injury, muscle or ligament or tissue injury as well. But again, there's just not a lot of research in those populations quite yet. Another area in where we're seeing collagen supplementation being studied is actually for cognitive function. It's thought that the cognitive function and brain structure can also benefit from collagen supplementation. There was a recent study showing that collagen supplementation of 5 grams per day for 4 weeks improved cognitive function and memory as well as brain structure as measured by a fMRI, so a functional MRI. And that is in healthy participants aged 49 to 63. So more research is coming out for that and another, again, potential use for collagen as a supplement. Now, we all have probably heard of collagen being used for anti-aging to help with the skin. Now, this can be done often orally or with peptides, even topically as well. There are a number of studies done taking oral collagen for 4 to 10 grams for 4 to 12 weeks has been shown to help improve the elasticity of skin in older individuals. And there are not a whole lot of studies with using it topically that are great because they often are not comparing it with any other intervention as well. Now, an interesting area in where collagen is being studied a little bit more is actually its glycemic effects, or more specifically, how it can help to improve insulin sensitivity. There is a particular study that shows that 5 grams of collagen peptides helps reduce advanced glycolated end products or AGEs, and they think that when the peptides help to reduce the AGE levels, that helps to subsequently reduce insulin resistance, making it potentially protective from cardiovascular disease, diabetes, and other states associated with aging. So more research is needed on that end to see how effective collagen supplementation can be for glycemic control. And another area related to skin is collagen supplementation effects on wound healing. There are not a lot of studies in humans. There are some mice studies that show that the collagen can help to enhance the function of fibroblasts or the cells that help with connective tissue. And this specifically is helping in wound healing, but more specifically with different types of burns as well. So more research coming out on the supplementation of collagen. How do I use this one? I actually tend to recommend collagen supplementation in women who are looking for a little bit of anti-aging. I will have them add it a couple grams a day into a protein powder or a smoothie powder, and generally it's more geared towards anti-aging and the elasticity of the skin. And particularly I've seen it be helpful, especially where the client is complaining of dryness in their skin. The collagen seems to help with production of ceramides, or that which is kind of moisturizing to the skin as well. So that's generally how I will work with a collagen supplement. Let me know down in the comments below if you are taking collagen, what you're taking it for, and how you're using it. And if you have any questions, leave them down below as well. Otherwise, I hope that you learned something, and I'll see you in the next video. Bye.